What brought me to VCU was the people. The day that I interview here, people here make me feel belong.
Our overarching mission is to take them from that medical student stage into a practicing radiologist. I think our faculty is diverse, our training is diverse, so it makes them fit in. All our faculty members really care for their residents.
Interventional radiology trainees, rather than doing a diagnostic radiology residency and then an IR fellowship, enter out of medical school into an integrated training program wherein they receive the diagnostic radiology training as well as interventional radiology training. It allows trainees to be involved on the clinical side of interventional radiology earlier in their training.
You have faculty and mentorship above that is very receptive to things that can be improved in the program. Having us as the residents from each class being involved in that process was pretty instrumental.
We don't have a lot of fellows, so we were very resident driven. Our residents do everything.
So it offers the pathology and the volume that I was looking for in a level 1 trauma academic center, tertiary care, without an astronomical cost of living or a slew of fellows to compete for the most interesting cases on the list.
With my program in particular with interventional radiology, it's very hands-on, learning from the residents above and then teaching the residents below.
It's important to strike a good balance between supervision and autonomy. As the trainees progress through the program, this balance shifts towards one of supervision to autonomy as they gain skills, competence, and confidence.
You have level 1 trauma, you have all the transplant services. Between all of that, you pretty much see everything that you're going to see in practice.
We train them in different modalities. We have a lot of different subspecialties within the hospital.
I couldn't imagine training somewhere better, to be honest, with the volume we see and the caseload we see. And then add in, on top of that, the fact that we have such good camaraderie with the residents. That was an added bonus that you don't know until you get there, but it's here.
We have the opportunity to work at several different locations, which are all, for the most part, located primarily downtown, and each offer different experiences within clinical radiology and exposure to different patient populations. Residents spend a fair number of rotations of their second year radiology residency at the VA, which in my opinion has the best patient population that we work with and also offers a lot of independence and freedom for residents at work.
There's a lot of opportunities to see different and new technologies here, for sure. We do a lot of cool things like MR fusion biopsies for prostate glands and things like that, which not a lot of programs have.
We have all the tools you need to succeed. At VCU, we do have a lot of autonomy when we're on call, but also when we need direct supervision, the attending can give us feedback on the cases that we do during the day, and the feedback usually instant, and they can see exactly what I'm looking at on my screen at the same time. So we never feel unsafe or uncomfortable when taking care of the patient. At VCU, we have a lot of educational resources that will help us to succeed. We provide StatDX for all the residents. We have shared drive that is a place the residents can upload the useful information for the rotations, for learning, for core exam, and all the books that we need.
We have several opportunities to interact and teach medical students. The most unique opportunity that we have is our cadaver project, where we meet up with medical students and take their cadavers to the CT scanner, and they're able to use those images to study anatomy. We're able to moonlight after work, and also on the weekends. You can work as little or as much as you want, and it's a great way to make extra money.
It's comfortable, and that's key here. Now, comfort doesn't mean that you don't get challenged, but it's comfortable in the sense that the faculty here is really warm and welcoming.
Faculty is really approachable. They are there when I need help. We talk about cases, about life, about their family. So I feel like it's a really warm environment.
Working in a group of very close-knit people does make residency, which is very stressful, easier.
We learn a lot, but we also like to have a good time outside of work as well. Richmond actually, I think, is a very underrated city.
I really love Richmond because we can do a lot of things outside work.
There's a lot of cool things to do outdoors, indoors, whether you want to go to the mountains or the beach, whether you want to go to a bigger city. DC is just a short drive away as well.
It is a great place to live, and it's a great place to do residency.
But when you're doing your radiology residency here, you will find that you have the right balance between your work life and your outside of work life.
They're successful when they find a place to practice where they're happy. For some of them, that means they go do a fellowship in a prestigious institution. For some of them, they can go right into private practice and thrive. You'll be very trained to go wherever you want to go.
I had a really good vibe during my interview here that that's the kind of program that it was, and it turned out to be true, so it was great.